Good morning. Thank you for getting up early to be with us today. I would just like to thank my co-authors and also Sosort for inviting us to present this paper. I have no conflicts of interest. The story for this paper actually started almost 50 years ago when I was hit by a car and was in very sad shape and was very fearful and had a very doubtful future. But a team of people came together, including an orthopedic surgeon and physical therapist and orthotists and nurses. And over a 5 or 6 year period, I was able to get back on my feet. And that's what motivated me to become an orthopedic surgeon. I was then blessed with a great mentor, Dr. John Hall, who was key for the development of Harrington instrumentation with Dr. Harrington and actually invented the Boston brace. He was my mentor during my residency at Harvard and fellowship. He treated every patient as precious, did everything humanly possible to help his individual patient, but constantly learned, innovated, and shared. I wanted to be like him. I wanted to become like him and wanted to influence others to do the same. But after 20 years in practice, I was dissatisfied with my conservative treatment plan. Over those years, I had perfected the surgical methodology, working with SRS, including developing the SRS safety checklist. But at the same time, my conservative treatment felt absolutely inadequate, with unhappy kids, inadequate bracing, and just no idea about the use of physical therapy. When Lori Dolan and Weinstein's paper came out in 2013, I was convicted that I needed to find a better brace and a better way to improve the system of conservative care. I was convicted and had to do research to find a better way. And I looked into the literature. This is actually the Weinstein data showing the importance of staying in the green zone, under 30 degrees. And I published an article about using this as a patient education tool, and also in my up-to-date chapter on adult scoliosis. And we actually have our own data from Hay Clinic showing that same green zone. So I was blessed to not just have great literature, but found great people who motivated me and our team to change. I was blessed to interact with Luke Steichleather and his team and met his physical therapist, Danny Hendricks, who taught me not just from the literature, but from their own experience, how the conservative method, working as a team, could change lives. I then was blessed to join your Sosort meeting in 2018, where I was overwhelmed with the strength of evidence for what you guys are doing, but I think is largely unknown by surgeons like me. So we actually set out to do a paradigm shift. The motivation is there's this American method which really hinges on observation and the brace, and then the European method, which is schroth early, Rigo brace, and has a very high success rate. So here's the paradigm shift story and what we're going to be studying in this paper. I have this old method where I saw patients with my PAs and sent them out for a Boston brace and often had to do surgery. The vision was to put together a synergistic team that included not just me and my APPs, but physiotherapists and orthotists with brace creation under one roof in my own clinic. And that is what we set out to do, and now we're studying the outcomes. So our objective is to look at the outcomes before and after this transformation, looking at progression to surgery, finishing in the green zone, and curve progression under 5 degrees. As a part of starting Hay Clinic, we built our own clinical and research database called Aqueduct, motivated by the aqueducts here in Italy, and it has over 40,000 patients in it with over 146,000 read images. Out of that, we had our inclusion criteria, eliminating neuromuscular and congenital, and then having the proper age and risk categories, as we always use for bracing studies and for schroth, with a minimum of 2 visits with x-ray measurements. This left us with a total study cohort of 2,102 patients, including all of these variables. This led to a pre-group of 615 before we made the transformation, a transition period of 223 patients over about a year and a half, and a 6-year period with schroth Rigo brace method with 1,264 patients. Our variables on these 3 groups are actually fairly comparable, And the transformation you can see here occurred right away with bracing and physical therapy going up and up during these 3 periods. Meanwhile, curves went down and continue to go down, and we're still working on getting them down further. Probably one of the most significant things is how we're able to keep patients better in the green zone. Beforehand, we could only keep about 60% in the green zone. That went up to 70%, and then up to 80%, which was a 32% increase than our pre, which is a huge change for kids then who become adults. That's a need to treat of 4. Meanwhile, our surgical rates went down, and they kept going down, and we're still driving them down. And if you look at the numbers, they're absolutely startling. 25% beforehand, which is comparable with many other surgical type clinics, and then it went down to 16%, and then down to 6%. That is a 75% relative reduction. That is big news. That's a need to treat of 5.4. So, this study definitely has limitations. Single-center retrospective design can't isolate which components exactly are there, slightly shorter post-op implementation follow-up, no compliance monitoring data, potential referral pattern changes, I don't control that, and not a randomized controlled trial. But it has some pretty big strengths. A very large sample size from a real clinic, 2,102 patients before, during, and after. A 20-year study period, real-world surgical practice data, not a design study, actually including the decision for surgery. Dose responses across 3 cohorts, same surgical team throughout, skeletal maturity endpoints verified, and big numbers for results. 75% reduction in surgery, need to treat 5.5 to 6. 32% increase in the green zone finishers with a need to treat of 4. So this is a big number study compared to some of the other studies that we've done before that we rely on every day. And it could potentially have major financial impacts as well. It's possible that we may have saved 234 children from needing scoliosis surgery with potential large impacts for healthcare savings and a potential return of investment of 10 to 1. So here's some key numbers to remember from this talk. 80% of these kids now can end in the green zone, and I think that could be even better if we catch them earlier. And 6% surgery, and I think we could even drive that less. Let's strive together to get that first number bigger and the other number smaller. So what are our next steps? We have to use this type of data to educate and motivate our patients and families. We can also use this to educate our payers about the value of conservative therapy. But we also need to drive change, not just through research, but through relationships. And I'm so thankful for the Sosort relationships that I've had that have helped drive this. And we need more mentorship and apprenticeship to do this, and long-term, 40-plus year real-world transformation research in screening, combining with top-notch conservative care. So in conclusion, teams changes lives forever. It did for me. And we need to include in those teams not just our surgical teams, but screening providers, the general public, insurers and payers, and societies like Sosort and SRS and your local societies. And if we do that together, we can transform lives, which actually brings joy. Joy to patients and families, but even joy to us as caregivers. It makes all the difference. I still remember the name and remember what my doctor and physical therapist did for me. And just a few months ago, I actually got together with Barbara Bader, my physical therapist, 47 years later, and gave her a big hug. Any physical therapists out there? Thank you. I still remember physical therapists, and we need people like them to work with it. It transformed my life and many others. Here are my references. So let's change lives together. I know many of you are international and I talk too fast, but so I am going to post a YouTube of this later today that you can get. And please contact me with any questions. Thank you very much.